Have you ever noticed something strange happening with your body and wondered what it could mean? Have you ever considered that it may involve your liver? While some signs of liver damage are well known, there are also some unexpected symptoms that can indicate trouble with your liver, which is what we're going to discuss in this video, so keep watching to explore the unusual signs of liver damage that might just surprise you. From mysterious bruises to unexplained itching, understanding these symptoms can help you catch liver issues early and protect this vital organ. So if you're ready, let's dive in. Number 1. Yellowing of the skin and eyes. Yellowing of the skin and eyes, also known as jaundice, occurs when there is a buildup of bilirubin in the body, a yellow pigment produced during the breakdown of red blood cells. This can happen when the liver is unable to process bilirubin properly due to damage or disease. Jaundice is often one of the first visible signs of liver trouble, indicating that the liver is not functioning correctly. It's essential to seek medical attention if you notice this symptom, as it can signify serious underlying liver issues. Number 2. Chronic fatigue. Chronic fatigue is a persistent feeling of tiredness and lack of energy that doesn't improve with rest. When the liver is damaged, it struggles to filter toxins from the blood, which can lead to a buildup of these harmful substances in the body. This toxin buildup can cause feelings of fatigue and general malaise. Additionally, liver damage can disrupt the body's metabolism and nutrient absorption, further contributing to ongoing tiredness. If you experience chronic fatigue, it may be a sign of liver dysfunction and warrants a medical evaluation. Number 3. Itchy skin. Itchy skin, also known as pruritus, can be a sign of liver damage. When the liver is not functioning properly, bile salts can accumulate in the bloodstream and deposit in the skin, leading to intense itching. This symptom can be particularly distressing and may not be relieved by common anti-itch treatments. Itchy skin due to liver damage often accompanies other symptoms like jaundice or dark urine. Persistent itching without an obvious cause should prompt a visit to a healthcare provider to check for liver-related issues. Number 4. Dark urine. Dark urine can be an indicator of liver damage, often due to an excess of bilirubin in the bloodstream that the liver fails to properly process. When bilirubin levels rise, the kidneys filter out this pigment, causing the urine to appear dark brown or amber. This symptom is frequently associated with jaundice and can be an early warning sign of liver dysfunction. If you notice a significant change in the color of your urine, especially if accompanied by other symptoms like fatigue or yellowing of the skin, it's important to seek medical advice promptly. Number 5. Pale or clay-colored stools. Pale or clay-colored stools can be a sign of liver damage, reflecting a lack of bile in the digestive system. Bile produced by the liver helps give stools their typical brown color. When the liver is damaged, it may not produce enough bile or bile flow might be blocked, resulting in lighter-colored stools. This symptom occurs alongside jaundice and dark urine. Monitoring stool color can provide important clues about liver health. Persistent changes in stool color should be evaluated by a healthcare professional to rule out serious liver conditions. Number 6. Bruising easily. Bruising easily can be a symptom of liver damage due to the liver's role in producing proteins necessary for blood clotting. When the liver is compromised, its ability to produce these proteins diminishes, making the body more prone to bruising even from minor bumps or injuries. Additionally, liver damage can lead to a decrease in platelet counts, further impairing clotting. If you notice an increase in bruising without a clear cause, it might indicate a liver issue, and seeking medical evaluation is essential to determine the underlying cause and appropriate treatment. Number 7. Swelling in the legs and ankles. Swelling in the legs and ankles, known as edema, can be a sign of liver damage. When the liver is not functioning properly, it can lead to a buildup of fluid in the body's tissues. This happens because the damaged liver produces fewer proteins such as albumin, which helps maintain fluid balance in the bloodstream. As a result, fluid leaks into surrounding tissues, causing noticeable swelling, particularly in the lower extremities. Persistent swelling in the legs and ankles should be evaluated by a healthcare provider to determine if liver dysfunction is the cause. Number 8. Abdominal pain and swelling. Abdominal pain and swelling can indicate liver damage and may result from conditions like liver inflammation, cirrhosis, or liver tumors. The liver is located in the upper right quadrant of the abdomen, and damage or disease can cause discomfort or pain in this area. Swelling, also known as ascites, occurs when fluid accumulates in the abdominal cavity due to increased pressure in the liver's blood vessels. This pressure buildup is often a result of liver scarring or cirrhosis. If you experience persistent abdominal pain or swelling, it's crucial to seek medical attention to investigate the cause. Number 9. Nausea or vomiting. Nausea or vomiting can be symptoms of liver damage, as a compromised liver can disrupt the digestive process and lead to gastrointestinal distress. When the liver is damaged, it may struggle to process and eliminate toxins, causing them to accumulate in the body and trigger nausea. Additionally, liver diseases such as hepatitis or cirrhosis can directly impact digestion and bile production, leading to feelings of nausea and episodes of vomiting. If you experience ongoing nausea or frequent vomiting without an apparent cause, it's important to consult a healthcare provider to determine if liver issues are involved. Number 10. Loss of appetite. Loss of appetite can be a symptom of liver damage, often occurring when the liver's ability to process nutrients and produce bile is compromised. A damaged liver can lead to an accumulation of toxins in the body, affecting various systems, including the digestive system. This disruption can result in a decreased desire to eat even when the body needs nourishment. Chronic liver diseases such as hepatitis or cirrhosis commonly cause this symptom. If you notice a significant and unexplained loss of appetite, it is important to seek medical advice to identify and address potential liver-related causes. Number 11. Confusion or cognitive issues. Confusion or cognitive issues, also known as hepatic encephalopathy, can be a serious sign of liver damage. The liver normally removes toxins from the blood, but when it's damaged, these toxins can build up and affect brain function. Symptoms can range from mild confusion and forgetfulness to severe disorientation and difficulty concentrating. In advanced cases, it can lead to significant mental impairment. If you or someone you know experience unexplained cognitive changes, it is crucial to seek medical attention, as this could indicate severe liver dysfunction requiring immediate treatment. Number 12. Spider angiomas. Spider angiomas are small spider-like blood vessels visible just beneath the skin surface and can be a sign of liver damage. These red, web-shaped marks are caused by the dilation of blood vessels due to hormonal imbalances often associated with liver disease. The presence of multiple spider angiomas, particularly on the face, neck, upper chest, and arms, can indicate liver dysfunction. While they can appear in healthy individuals, their occurrence in large numbers should prompt a medical evaluation to check for underlying liver conditions, especially if accompanied by other symptoms of liver damage. So, as you can see, understanding the signs of liver damage is vital for early detection and effective intervention. If you experience any of the symptoms discussed, it's essential to consult a healthcare professional for a thorough evaluation. Timely recognition and treatment can significantly improve liver health and overall well-being, preventing serious complications and enhancing quality of life. But real quick, be sure to watch some of our other helpful videos that are popping up on your screen right about now. And just a quick reminder, we are not doctors. This video is for informational purposes only.